Hello, everybody. My name is Dr. Sherry Dark-Goudeau. Usually when you see me here is for Touchtone Tuesday. Today, I'd like to share some information about something that I believe affects all of us very seriously, and that is the current COVID crisis. Before sharing this information, I'd like to extend to you my waivers. I am not an expert in immunology, epidemiology, or infectious diseases. I am a board certified licensed physician in the state of Texas, and I will be sharing data from meta-analysis via the CDC, that is Centers for Disease Control, NIH, the National Institutes of Health, and the FDA, the Food and Drug Administration, along with various clinical trials which are open to the public at large. Recently, as recently as yesterday, I received information on the deaths of a close family friend, as well as a sister reporting two close significant loved ones dying only 2 days apart in this current COVID crisis. And yes, it became a little too real. We've also discovered that Texas, just 2 days ago, is reported as one of 8 states, accounting for 24% of the US population, but now responsible for 51% of the new COVID infections resulting in hospitalizations. That is Texas, along with Alabama, Arkansas, Florida, Georgia, Louisiana, Mississippi, and Nevada. These are the states that we report in the red or the hotspot. Of all the hospitalizations now with new COVID infections across the United States, 97 to 99% of them are from unvaccinated persons. The remaining 1 to 3% then are from those who have received the vaccine and yet still have breakthrough COVID infections. So the questions now come, what's happening? What's going on with our healthcare system? Well, it's actually multifactorial. Let's go back to the beginning to get a great understanding. COVID-19 via SARS hit the headlines for the United States somewhere along December 2019. At its height in the early spring of 2020, it created a pandemic causing a global shutdown. In July 2020 and January 2021, the United States experienced 2 of its all-time surges, and now we're in another surge. So as we look at this, we must look at all of the factors that have taken place. We have 3 variants currently of COVID that have been identified. That is the SARS that created the pandemic. Now we have Delta, who apparently has come through the UK and much of Europe, now in the United States, considered very contagious, debilitating, and deadly, especially among our younger population. And over the last 1 to 2 months, we've identified Lambda, for which the research is still somewhat conflicting. Some say in South America, possibly neutralizing the vaccine, and in other studies, of course, stating that the vaccines that we do have are very efficacious. What about the treatment when someone is sick? We have antivirals now. We have monoclonal antibodies. We still have great supportive care in the form of antibiotics, steroids, and of course, an amazing medical staff for which we can't say enough about. And even with that, we're still facing a crisis, even with the current antivirals being somewhat 99% efficacious in some clinical trials. We also have prevention. We have 3 emergency use only vaccines, of which Moderna, Pfizer-BioNTech, and of course, Johnson & Johnson are among those. Of the 3, Pfizer-BioNTech is the only one that is set to be FDA fully approved within the next few weeks. And Pfizer is also the only one which offers an emergency use only vaccine in those who are 12 and older, again, assisting our school-age kids. So with so much help on board, what could possibly have stopped us from being able to enter the re-entry period post-pandemic freely? Well, let's start with those who are vaccinated, because that may be the most perplexing of the puzzle. For those who are fully vaccinated and what we call immunocompetent, that is those who are otherwise healthy and elected to receive the vaccine, it has been our hope that 90 to 94% immunity or protection would be achieved. And if that particular range were actually achieved, it was our hope and belief based on clinical trials that if an infection occurred, that it would not be as deadly with only minimal signs and or symptoms. That's one population. Our second population is those who have elected to receive the vaccine and they are immunocompromised. Immunocompromised meaning they suffer with comorbid states such as diabetes, cancer, lung disease, heart disease, perhaps renal disease resulting in dialysis or some other form of debilitating disease that has created a stressor on their own immune system. In this population, we also hope the same. We hope that they would achieve 90 to 94% immunity. But sadly, according to the CDC, again, the Centers for Disease Control, many have only achieved 59 to 72% immunity or a protection, meaning that they are open to COVID breakthrough infections and possibly a part of this current COVID crisis. Now remember, in this particular COVID crisis, those who are vaccinated account for 1 to 3% of that population. But of that population, the immunocompromised make up 1/3 of it. Now, if they make up 1/3 of that population, that leaves 2/3 of that population that are more than likely immunocompetent and yet still have a breakthrough infection. Well, what happens with this population? A couple of factors, possibly 3 to be exact. The first of those is that, one, they never really achieve the 90 to 94% immunity or protection for whatever reason. 2, they are encountering other variants of COVID, which are more contagious and possibly more deadly. Again, we have Lambda that has been identified, but the research is still out. And we have 2 additional variants that are being tested for in every infectious disease panel, which are unidentified. We call them variants of interest. So these things may actually be muddying the waters. And 3, probably the most significant of all of these, is that sadly, vaccinated people, immunocompromised and immunocompetent alike, have believed much of the time that the vaccines bring them to a 0 risk for COVID infections. That is completely untrue. It is an untruth. It is a falsehood. It is a lie. No vaccine will ever bring us to 0 risk for future infections. With that being said, we are now seeing a current surge. The vaccines do help to decrease that risk with an 8-fold reduction, but it is not 0. And then, of course, our third population now, which are our children, school age, 12 years and younger, who are not eligible for any vaccine, but are encountering twice the risk with increased hospitalizations all throughout the nation, now at its highest since the worst surge of COVID in 2021 of this year. We're seeing increased respiratory effects, hospitalizations requiring ventilators, and heart-lung bypass. ICU beds are limited due to decreasing staff. How does that happen? Well, a hospital may be licensed for 100 ICU pediatric beds, just as an example, but they may only have medical personnel to staff only 50 beds, which means that when the 50th bed is taken, they are now at fully staffed capacity, although available beds remain. This poses a great risk for healthcare to all of our children. What makes this particularly dangerous, aside from the devastation to our children, is that it also poses a risk to the caretaker, the parents, the guardians, the siblings, and all of those that love them. And therefore, it's twofold in its effect and in its nature. So what are our questions now? To vaccinate or to not vaccinate, to mask or to not mask, to social distance or to not social distance, biological, Is this, or is it really political? Is it a risk, or is it our rights? We have now proposed suggested answers with all of the data that you have just heard. Number one, and it's a big number one, if you're fully vaccinated or have received the vaccination, do not be comfortable or confused that your risk will go to zero. That will never happen. Again, this is an untruth to believe that it does. For those who are immunocompromised, the FDA, the Food and Drug Administration, just authorized a third dose to achieve immunity of 90 to 94% in this population. You may want to speak to your healthcare providers about receiving this particular vaccination if you elect to. For all others who have been vaccinated and have developed natural immunity from infection, this next statement has not been a recommendation of the CDC, the NIH, or the FDA, but it is a very strong consideration. In these particular populations, it is a consideration we feel is prudent based on the work of the body's own immune system in fighting an infection. That consideration is check your antibody status. Check your antibody titers at 3, 6, 12, and 18 months. Yes, check your antibody status, your antibody titers at 3, 6, 12, and 18 months. Why this particular timeline? Well, with the current data, again, it is believed that whether you have achieved natural immunity from a prior infection or perhaps artificial immunity at that 90 to 94% range, most will last 90 to 180 days by most of the reports that we have received. And thereby, the consideration is as it is 3, 6, 12, 18 months to check your antibody status. If the antibodies are negative, it means you have no immunity, no protection on board. If the antibody status comes back equivocal, meaning it's indeterminate, it means that your antibody status is uncertain. And so we can make a pretty safe assumption that you may not be covered or protected. In those cases, please speak to your healthcare provider or your healthcare community if you elect to receive the vaccine about receiving an additional dose to boost that immunity to 90 to 94% and receive protection. That's a big number one. Number two now, for all, this is something we all can do. We all can wear our mask. We all can social distance. We all can hand sanitize, especially in public settings or with travel. And please check travel recommendations from the CDC prior to making your reservations. Number three, for all, again, this is something all we can do, all of us can do. If you are sick, especially with fever, cough, or uncertain of your COVID status in this particular setting, especially with infection, please self-quarantine until you are tested. Number four, for all, again, something all of us can do. If you are exposed to a known COVID infection, please self-quarantine, as you may be able to spread the infection even if you are not affected. This is especially true if you are returning from travel. Please be kind. Self-quarantine for 3 days. Check your COVID status as far as infection is concerned before returning to your loved ones, your family, especially if someone is immunocompromised in that setting. And number five, for all, we bid all of you Godspeed, good health, and good sense as we all do our part in minimizing the spread of COVID. Continue praying for a stressed and very strained health care, our medical system, now with makeshift COVID units in what used to be outpatient facilities. They are at capacity and beyond, as they once more shoulder the burden for our health care with their sacrifice. I am reminded, as we've shared all of this information, that there is an account in the book of Numbers 21, verses 5 through 9, where the children of Israel were bitten by serpents, largely due to their own disobedience. They cried out to their leader, Moses, on what that answer may be to help them, to save them. Moses inquired of God himself, and he was given an answer. Make a serpent of brass, put it on a pole, and hold it up in the midst of the people. Have them look at it, anyone that has been bitten, and thereby they will live. They will be saved. He did that, and they were. They lived. They were saved. What does that text say to all of us? The take-home point is maybe the very thing that bites us will be the very thing that cures us. So as we contemplate whether to receive or not receive the vaccine, whether to mask or to not mask, whether to social distance or not social distance, to consider whether this is biological or perhaps only political, and even to decide if there's a risk or is it our rights. Please remember that perhaps the very thing that has bitten us will be the very thing that saves us. Take care. Have an amazing Sunday and enjoy. And hopefully we'll see each other over the years as well as the decades in safety and full health. Have a great day.